Hi everyone. The American Heart Association creates the guidelines for the CPR and the fast aid to help the healthcare providers and community members perform effective resuscitation on people in cardiac arrest. These are the guidelines followed by the individuals and organizations across the world. So, where do these guidelines come from and how are they developed? AHA is a part of an international licensing committee around the world, and then they take this evidence, review it, and create the treatment recommendation and algorithms program which help you to become trained in this specialty. I'm Dr. Pungudi, Associate Professor, Department of World Medicine Radiology, Meenakshi Academy of Higher Education and Research, Chennai. What is cardiopulmonary resuscitation? It is a life saving technique useful in many emergencies, including heart attack or near drowning, in which someone's breathing or heartbeat has been stopped for a while. The American Heart Association recommends that everyone, an untrained bystanders and a medical person alike, begin CPR with chest compression. American Heart Association Guidelines 2015 has stated that untrained or trained and ready to go, untrained but trusty. Untrained, if you are untrained in CPR, then provide hands only CPR. Trained and ready to go, if you are well trained, confident in your ability, check to see if there is a pulse and breathing. If there is no breathing or pulse within 10 seconds, behind chest compression and start CPR with 30 chest compression before giving 2 rescue breaths. Trained but rusty, if you previously received a CPR training but you aren't confident in your abilities, then just do the compressions at the rate of 100 to 120 per minute. American Heart Association says the advice applies to the adults, children, and infants needing CPR, but not to the newborns, infants up to 4 weeks old. CPR can keep oxygenated blood flowing in the brain and to the other vital organs until a more definitive medical treatment can restore a normal heart rhythm. When the heart stops due to the lack of oxygenated blood can cause a brain damage in only few minutes. A person may die within 8 to 10 minutes. To learn a CPR properly, take an accredited first aid training course including CPR and how to use an automated external defibrillator, also called as AED. If you are untrained and you can still provide a basic life support to the victim and have an immediate access to the phone or call 108 or any local emergency number before beginning the CPR, the dispatcher can instruct you in the proper procedures until the help arrives. Before you begin, check is the environment safe for the person? Is the person conscious or unconscious? If the person appears to be unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person does not respond and two people are available, have one person to call 108 or any local emergency number. As soon as an AED is available, deliver one shock if instructed by the device, then begin the CPR. Emergency first aid. We use CPR when someone has collapsed and is not breathing because it can keep the people alive until the ambulance arrives. Learning these simple life saving skills is as easy as ABC. All you have to remember is the doctor's ABC. The D is for danger. First, look around carefully to make sure the area is safe for yourself. And R is for response. Call and response. Shake and shout. Shake them gently by the shoulders and ask them loudly, "Are you okay?" If there is no response, you need yes for shout for help, for assistance, and make sure the ambulance is on its way and put the phone on the speaker mode is useful as the ambulance service can talk to you through and guide you. A is for airway. Gently tilt the head back like this to open the airway. And B is for breathing. Look, listen, feel for the signs for the normal breathing. Look for the normal chest movements, listen for the normal breathing sounds, and try to feel the breath against. If there is no sign of breathing or if they are breathing in an unusual noisy way, then we see for circulation. Circulation means the flow of blood around the body when the heart stops pumping, and we need to take this role by pushing down hard and fast. Start by placing the heel of one hand at the center of the person's chest and interlock with the arm straight. Press down hard and fast. letting the chest come up back fully and push hard and fast each time. Hard and fast means around 2 times every second and go down about 5 centimeters or 2 inches. If you have been trained, you can give 2 rescue breaths after every compression. As however, if you have not been trained or not comfortable, just keep going with hands only. If someone else is with you, swap over if you begin to feel tired and don't stop until either the health professional take care is over or the person is definitely breathing normally. And D for defibrillation. It delivers a shock to restart the heartbeat. Some public areas or workplaces have easy access to the defibrillator on the site, called as an automatic external defibrillator. The machine that decides what to do as designated, and even it talks to the steps. If there is no AED available, keep going with CPR until the ambulance arrives. Recap: steps you can take to help someone who has been collapsed, is not breathing or not breathing normally is doctor's ABC. D for danger, R for response, A for airway, B for breathing, and C for circulation. American Heart Association Guidelines 2010 has given a component of recognition CPR sequence, compression rate, and compression depth based for the adult, children, and the infant. So, when do you recognize unresponsive patient, no breathing or abnormal breathing, or only the gasping, there is no pulse palpated for 10 seconds for all age groups, then you do a CPR. A compression rate at least 100 to 120 per minute. Compression depth for adult and children will be at least 2 inches, that is 5 centimeter, and for infant it is about 1 inch and 4 centimeter. A standard training course to practice these steps are recommended and are mandatory for the healthcare professionals that enhance the best first aid support to the victim. Thank you for listening to my presentation.